So just speaking to our last conversation, this pill is a GLP-1 receptor agonist, but it is not a peptide. So it doesn't have to have that filming or casing like some of the other tablets. Now, when you're talking about injectables, the once a week injection that you're traditionally talking about for GLP-1s is going to last 5 days or longer, whereas the tablet takes a few days to build up, but it's only going to last like the half life for 24 to 48 hours. I think some data is saying up to 60 or 70 hours. So I think if patients are looking for a little bit of slower, like going easy and going slow, or maybe just dipping their toe in, to get used to something, this may be kind of like our gateway instead of an injection. And of course, some people are nervous with needles or injections. So I see patients that are looking to lose weight that maybe have not been tagged as having type 2 diabetes. Maybe they're at risk for type 2, or maybe they have type 2 in their family, or maybe they've got cardiovascular issues or high cholesterol, and they're looking to just overall decrease risk factors, looking at weight, looking at overall health. This would be a great option for them, just something gentle to ease in. The GLP-1 receptor agonist with Foundayo, it seems that it takes about a week or so for it to build up in their system when you start taking the tablet once per day. But usually you see that weight loss within the first like 4 to 6 weeks. We're seeing good weight loss comparable to some of the other GLP-1 receptor agonists. So I think people should start seeing weight loss within that first month. Again, you start at a lower dose. This tablet comes in about 4 or 5 doses and we titrate up. So we always start low and go slow. It's going to depend on how much weight you have on, as of course, how much percentage of weight lost. So it's not super rapid, which I think a lot of consumers are looking for. If they are looking for a change, they're not looking for something sudden or crazy or even noticeable. They're looking for something gently to kind of like help them with behavior change and change maybe habits of maybe they're eating healthy, but maybe they're just looking for like to eat less or lower portions. This could be something gentle to help with that. It can be taken with or without food, whereas your traditional GLP-1 receptor agonist tablets have to be taken on an empty stomach without food. So that can be a little limiting to someone's schedule. When you're looking at the weekly medication, some people miss or they forget to take the weekly injection. You would think, oh, less is more, but some people forget and then you have to wait and then they miss like that effectiveness. And with this, you can take it at any point of the day. I see a lot of people taking this right in the morning when they wake up. Maybe they take it with other medications. Maybe they take it mid-morning and they're not so stressed about, other medications or just skipping it altogether. So maybe people will be more like compliant with taking it on a regular basis, which will be more helpful with them when they're forming eating habits, especially because that's what we're looking for. This is indicated for weight loss and people are looking to make changes, but you need to create habits to make changes. And so I think not having limitations on when and when you cannot take it is going to help you make better habits. So the most common side effects with Foundayo are very similar to any of the other GLP-1s for weight loss. You're going to have most commonly would be GI upset or stomach upset, acid reflux. You could have some mild nausea. You could have some constipation, delaying the GI tract. Typically, a very low percentage of patients have this, and it will flare up on occasion with certain foods or triggers. Maybe if you go, out to eat and get a fried chicken sandwich versus, maybe something lower in carb that you're eating a home cooked meal, you're maybe less at risk to have some of these GI side effects. Other people feel fatigued. Some people feel tired. I think it's really dependent on the person. We typically see the GI issues the most. And when we initiate medications in this drug class, similar to Foundayo, usually within the first 4 weeks, they start to kind of ease if you do have side effects. And they usually ease up after that 4 weeks. So that's the good thing about it. You should always contact your provider if you're having side effects. And sometimes there are medications that can offset side effects, like, something for constipation or, potentially a medication for nausea to help. Or maybe you're advised to skip your medication for a week or something like that if you're having really bad side effects or, and then we would get someone checked out. So it's best to say something about it and just check it out. And then we can go from there and evaluate, is it worth continuing this medication? Should we take a break? Do we just treat the symptoms? Are they mild enough? Are the adverse events or GI side effects mild enough that they're tolerable? And then we can continue. So some of them are not very severe and they're tolerable, and then we can keep taking the medication. No, I'm excited about having just another option for Foundayo. The Achieve 4 results looked great. I think we're all looking for cardiovascular, protection. That data didn't show it, but it showed that it was non-inferior to insulin. And we know sometimes with insulin can cause people to gain weight. We saw that in other clinical trials, and we're trying to help people lose weight. So that's an important thing to note, is that we're trying to get A1C reduction, of course, in people that need it, but we're trying to help them lose weight. So when we're talking insulin, of course, insulin works. It's great. It works quick. But if you don't need it and we're looking for some weight loss, then the Orforglipron is a great option. So I'm excited about this tablet.